Joints are where two bones come together. Note that classification for these is debatable and dependent upon the author. The way they are presented here is the same as your textbook. Fontanelles. These are the soft spots in the cranium of infants. They are unfused space between cranial bones that allows for bone growth. A fibrous membrane connects the bones. Bone occurs through intramembranous ossification. They usually ossify by age 1. This chart summarizes the joints that we will be covering in the next slides. There are 4 different categories, and they are organized based on the type of joint that connects the bones and the degree of movement. Synostosis, or bony joints, is when two bones fuse, eliminating a gap, and they become one bone. We see this in the mandible and frontal bones. Both bones start out as 2 separate bones in infancy, but fuse into one solid bone. The joints have no movement whatsoever. Synarthrosis, or fibrous joints, are bones bound by short collagen fibers. There is little to no movement here. There are also 3 kinds of fibrous joints. Number 1, sutures. These are the joints found between cranial bones. Number 2, gomphosis. This is the joint between a tooth and the mandible or maxilla. And number 3, syndesmoses, a slightly more movable joint. Its fibers are a little longer, which allows for slight movement. The fibers here hold 2 bones together next to each other, like with the ulna and radius, or tibia and fibula. Amphiarthroses, or cartilaginous joints, are 2 bones linked by cartilage. There is some movement here. 2 types of amphiarthrosis can be found. A synchondrosis is bound by hyaline cartilage. Examples are the joints between the diaphysis and epiphyses, or the first rib and sternum. A symphysis is a thick layer of fibrocartilage that binds 2 bones. The pubic symphysis and intervertebral discs are examples. Diarthroses, or synovial joints, are freely movable. The joint is covered by a joint capsule with an outer fibrous capsule and an inner synovial membrane, which secretes synovial fluid that works to lubricate the joint. The joint also contains an articular disc or a pad formed by the joint capsule and covers the entire joint surface. In the knee joint, we have the meniscus, which is an extension of the cartilage and covers part of the tibia. The menisci act as shock absorbers and help stabilize the knee and keep the femur from moving side to side on the tibia. We may also find a bursa, or fibrous sac, filled with synovial fluid that cushions bones and allows tendons to slide over bone more easily. A tendon is a structure that attaches muscles to bones, usually around a joint or large bony landmark. Ligaments, on the other hand, are structures that attach bone to bone and allow them to be connected at the joints. Both are made of dense, regular connective tissue. Diarthroses joints come in 6 forms. 1. Ball and socket. This allows for extensive movement in multiple directions, like the hip and shoulder. 2. Hinge joints work like a hinge on a door, and only in a particular direction. Your elbow and knee are examples. Number 3. Pivot joints allow for rotation, as in the head of the radius. Number 4. Saddle are saddle-shaped joints and can be found between the trapezoid and first metacarpal joint of the thumb. They provide your thumb with a greater range of motion than the other fingers. Number 5. Condylar are between the metacarpals and phalanges and allow the hinge movement at your knuckles, but also allow your fingers to move side to side slightly. Number 6. Plane are flat with a slight curve and have a limited amount of movement. But when taken collectively, they provide an extensive range of movement, as in the wrist and ankle.